Okay, today we are going to discuss very much important topics, and these are tiredness, fall, dizziness, and confusion. These are quite common topic which are coming every day. You can go and you can see every day the station are coming. You are going to see one of the station every day among these station is coming, because these are quite important station. So basically there are four approaches we are going to discuss over here. One is tiredness. As we have seen that regarding the medicine, it is a way more important than how you approach to the patient is important. So this is not like tiredness carries four scenarios, fall carries four scenario, dizziness one scenario, because I couldn't find another. There are other one we are going to correlate in another lecture. And confusion, there are three scenario. These are a little bit related scenarios. So what I did, I actually among all the notes I have, I brought this scenario up, and I went to the NHS site. I saw their management, because I have not seen any notes which are according to the NHS site. Even you people can put see by yourself and give your input, because the management pass you need to look for at NHS site. This is, I'm sure about that, because I have seen many errors in the notes regarding the management part. So you people can do work as well as we are doing, because a lot of scenarios have to be done. So I tried my level best so that I can correct these management part, but still your input is required. Okay, so let's start by our first scenario. This is the tiredness approach. Okay, when a patient comes to you and it says, okay, what brought you here today? And it says, I'm having tiredness. Tell me your differential diagnosis. Everybody write your differential diagnosis, because this is the way we deal with. Everybody write your differentials for tiredness, because I want your involvement to be in CA. Okay.
Hypothyroidism, obstructive sleep apnea,
It's better you write,
diabetes.
because it is better you write,
Okay.
because everybody is writing.
Okay.
You make a list of four, everybody make a list of four and send it together, so that it can be an attractive session. Autoimmune disease is perfect, but you need, but when I say the differential diagnosis, keep in mind the first thing should come in your mind is the dangerous most, second the common most, then otherwise in every scenario at least 4 DD should be in your mind, because if you have 4 DD in your mind, then you can do your best. Okay, depression, anemia, hypothyroidism, autoimmune disease, perfect. Obstructive sleep apnea, perfect. Hypothyroidism, cancer, chronic fatigue, anemia, these are all anemia, leukemia, because leukemia is kind of anemia, because actually the symptoms are because of the anemia or because of the cancer. Chronic disease, these are all kind of, okay, perfect. Okay, keep in mind, look, we have to go for the 4 DD or the 5 DD. We cannot rule out all these DD. That's the tip I'm going to give you. Whenever, first of all, when patient says, okay, I'm having what? Tiredness. This is very open symptom, very open. What is the tip regarding that? Okay, so you start exploring that. What need to be explored is TOO, T-O-O, time, frequency, because sometime in the time you have to ask, since how long you have been having that, and how much do you have that. Okay, it's always there, it's staying the same. You ask the TOO. Similar, people ask Odipara. Okay, please mute your mic. All of you, please mute your mic, because if some disturbance comes here, it gonna like disturb our lecture. Okay, so first of all, you have done what? TOO. I call it TOO because I have arranged this question in that way. In my first lecture, these are the arranged, very arranged questions you can see over there in the first notes. TOO, asking about the TOO, then you ask about the 4DD. After asking about the 4DD, okay, he's going to give you some clue. Okay, if he doesn't give you the clue, what you're going to do the systemic inquiry. In any broad spectrum disease, do the systemic inquiry. You can make your own list of 5 to 6 questions for the systemic inquiry, and that should be the constant. Whenever the word written is there, the systemic inquiry, do that. What can be that? Infection, headache, any problem with GIT, for example, vomiting, diarrhea. So start from here and go below. Okay, headache, confusion. Okay, one is gone. Any ear discharge, gone. What can be the other thing in the system inquiry? Any vomiting, any diarrhea, any problem with the urination, any abdominal pain, any blood in the stool. So this is kind of systemic inquiry. Any palpitations. Okay, these or any, these are the system inquiry. Just give me a time because there is some disturbance. Let me ask to mute the mic. Okay, so in these kind of scenarios, always do the system inquiry. Why I am putting so much stress on the system inquiry? Because they will see you the struggling for the scenario, that will carry marks. Actually, the struggling, you are struggling for the diagnosis, that is the marks. So in this kind of scenario, like it is the tiredness or it is the confusion, because it's a broad spectrum scenario, there are a lot of things that can cause these symptoms. You ask your DD and jump onto the systemic inquiry, and then ask the red flags, and red flags are the same. What are the red flags? That are the cancer symptoms. We have talked about that. I need not to talk about that again and again, because we have already talked about that thing. Okay, so come regarding the tiredness. So approach to the tiredness, differential diagnosis. I'm not going to talk about TUPA or STUPA, because here it is the TUPA, because you are asking about the TUPA. Then it is the differential diagnosis: anemia, hypothyroidism, depression. Okay, these 4 are the most common. These 4 are the most common. For example, you can start with like anemia, because nothing is dangerous, but anemia is quite common. Similarly, these are the other things which are less common. So you can asking the question after these 4, what you can do, you cannot remember all that in your head at a time. So what you can do is, after asking these 4 questions, okay, I want you to like ask the questions. Anemia, because I want you trained in that way, that you people should know how to ask this question as well. Anemia. Okay, for anemia, what question you're going to ask? Just write down quickly. What question regarding the anemia you are going to ask? Whenever anemia diagnosis comes in your mind, this question should be there. What question? Great. Shortness of breath. Shortness of breath is enough. Don't go like shortness of breath on exertion. Shortness of breath, exertion, heart racing. These 2 questions. Only put these 2 questions in your head, because you are asking in general. Whenever he says yes, then another window open, then you need to ask more questions regarding the causes of anemia. So still we need to ask heart racing. No need to ask dizziness even. You ask only one question. What could be shortness of breath or heart racing? This is one question. Ask in a single line. Any shortness of breath or heart racing. This is the one question for anemia. Okay, hypothyroidism. What question could be for the hypothyroidism? First question. Okay. Cold intolerance is the better. Cold intolerance is the better, but how you are going to ask the cold intolerance? I suggest 2 things: constipation and cold tolerance. Initial questions. But if he says yes, then you're going to ask all the questions. Even you're going to ask about the skin and everything. Do you feel cold when adults feel normal? Great. This is the exact question you need to ask. Do you feel cold when adults feel normal? Okay. Do you have the constipation? That's it. No, do you have any constipation? That's it. No need to ask more, because if he's not he says no, okay, it's ruled out already, because we have to go on. Okay, so these 2 questions are for hypothyroidism. That's it. Depression. What is the most common question we ask about the depression? Yeah, exactly. Do you feel low? The first question should be, do you feel low? This is the most common question you need to ask. Do you feel low? How is your mood? Do you feel low? This is these are all questions. Lack of interest, because to rule out, whenever we are going to study in a very detail, when we are going to, I have only one complete day session on the psychiatry, and in that we are going to study in a very detail how we ask this question. But here, which question? How is your mood? Do you feel low? Same question. Do you feel low? Okay, by any chance, do you feel low? Do you have do you have lost interest in daily activity? That's it. Not more than that. These two questions are enough. Okay. Then any of these other questions, do you have any long-term medical condition? And these things are we are going to ask in, like we are going to ask in PMMA, hospital family dysphagia. These all we can ask over there as well. But here we need to ask an other question that is must do the one question should be from the rheumatology. One question, because it's gonna cover a lot. Do you have any body aches? Okay. Do you have any stiffness of your joint, any morning stiffness? So you need to ask one question from this, any rash in your body. So this is the very typical question. You can ask this question as well. So you should ask actually in this kind of question, because the scenario with polymyalgia rheumatica can come with tiredness. Even most often it comes with the body aches, but it can come with tiredness as well. Okay, you need to ask one question for these three things: PMRA, rheumatoid arthritis, and SLE. It's called rheumatology question. Okay, then you can ask regarding, but you are going to do systemic inquiry. You need not ask any question regarding that. You can do the systemic inquiry. Otherwise, only ask 4 questions: 4 DD, 1 anemia, hypothyroidism, depression, and 1 is the rheumatology. Okay, after asking these questions, then you are going to like go for the red flag, that is the malignancy rule out. You are going to ask this question. Okay. Okay, after that, for example, nothing is coming out. You have asked all the questions, nothing is coming out. You can ask a few questions from here, not all of them, because these are very general. The symptom had started after flu-like symptom, because in this is the chronic fatigue syndrome. Chronic fatigue syndrome is basically a functional disorder, and actually this is the diagnosis of exclusion. Likewise, IBS. Likewise, IBS. IBS is the diagnosis of exclusion. Similarly, chronic fatigue syndrome is the diagnosis of exclusion. So what you need to do, you need to ask a lot of questions. Then you need to reach to the conclusion that it is chronic fatigue syndrome. You need to do all of the tests. Then you can reach to this conclusion. Okay. So you can just read these questions, and any 1, 2 comes in your mind, you can ask. No need to bother about that. If you are not having anything you have asked all the thing, then you must know that this is chronic fatigue syndrome. Otherwise, in anemia, they are going to give you some clue. Hypothyroidism, depression, there will be a clue. Everywhere there will be clue. There is no clue. This is chronic fatigue syndrome. Okay, we are going to discuss in the scenario particularly. Okay, then always ask in the fatigue. One is quite important. The one question is quite important when you are dealing with effect of exercise. Effect of exercise, or you can ask your symptom, your tiredness, relation with the day. How is in the morning, how is in the evening? Because there is a certain tiredness which, for example, myasthenia gravis, while you are reaching to end of the day, and that increasing tremendously. So you need to ask this question: effect of exercise, effect of the day, whichever comes in your mind, you can ask. Any specific time you feel tired? Okay, Bill, that's a great question. Question you can ask by yourself in any way. The concept should be clear. I'm not restricting you to ask only question. I'm telling you, you can ask any question which comes in your mind, but that should be the written one. That should be the spoken one, because in the exam, when the patient is in front of you and the meningitis is in your head, and you have not asked so many times these questions, you'll not be able to ask these questions. Like, for example, you cannot ask, do you have any photophobia? Do you have any shyness with the light? Do you have any neck stiffness? You need to ask this kind of question again and again. So that should be okay. Any specific time you feel tired? This is great. Okay, we have talked about the red flags already. Red flag is flaws, mnemonic, in which with the cancer system we rule out. Okay, this is all I need to tell you regarding the tiredness approach. Now we are going to discuss about the scenario. The first scenario is regarding chronic fatigue syndrome. You are FY2. Okay, the things you need to keep in your mind, what are they? FY2 is, you know, it's always FY2, GP. So this is quite important because there are certain treatment you cannot offer on the GP. If you are in the emergency, you can offer. So this should be in your mind always. That where you are, it should be the prime important in your mind. Okay. Louis, man come to the GP practice with some tiredness. This is a very open question. So you need to ask anything, everything we have talked about. Other information, IT system of the practice is down at the moment. The IT system is down. So you cannot get access to the record. Take the focus history, discuss the management with the patient. Okay. So one thing you need to know about, your IT system is down. You cannot get about his old history. So what should be done? Actually, this is a trick. First of all, you need to apologize. I'm sorry, Mr. No, what's name? Mr. Levis, Mr. Lewis. I'm sorry that our system is down. So I need to ask a few questions regarding your health so that we can reach to a better conclusion. Okay. So you need to apologize first after greeting the patient. So other information, opening sentence, doctor, I'm tired again. So I came back. What is the clue in this scenario? So what we do in general, we go templated. For example, if it is the down, still it is, in most of the scenario, it is written outside. It is the follow-up visit. It is the follow-up visit, but not written over there because your system is down. You do not have the follow-up notes. So what you need to explore in that, first of thing, 4Q. What are the 4Q? Okay, somebody write that 4Q. So everybody should know about, and you should have that involvement. What are the 4Qs which I talk about? So somebody should write these 4Q, because these 4Qs, 4 questions, you are going to encounter a lot of time. Whenever there is a follow-up visit, you are going to encounter these 4 questions. If you know, I can repeat for you, but I want you to write. Okay. What was the reason in the first visit? Second one, what investigation they did? Okay. Third, yeah, exactly. What they told you. And fourth one is left. This is the second one, what investigation, what they told you. And what is the last one? What is the treatment offer? These 4. Similarly, we offer these are the things we do in our everyday station. So these 4 questions you need to ask. So in this question, in this scenario, you need to ask 4 questions. Why? Because it's a follow-up case. However, it is not written here. FY2 general practice, he come with the tiredness, not written. When you ask the patient will tell you that I came back. I'm tired, I came back. So this is clear follow-up case. Okay. Old man, 6 months ago, constant tiredness. 6 months ago, suggests cause is not clear. The doctor suggests some blood test. You had the plus test done, but you're not the sure blood test. You are experiencing tiredness. You are not able to. This is quite important thing. If you are not going to ask to the patient, he's not going to tell you. This is the clue. For example, we have been asking in which question they are going to tell us. Okay, any student, which question I'm going to ask in my template, in my approach, not template, in my approach, which question the patient going to answer this, because this is quite important here. And sometimes we forget to ask this question. This is very common. We forget to ask this question. Any student, I'm waiting. Which question we are going to ask and patient going to tell this answer. No, it's not sexual history. No, this is not. Impact, exactly. Impact of symptom, effect of symptom, effect of these symptom on your life. Exactly. This is the question you're going to ask. The patient is going to say, so when we say ICE, PMMA, Holy Family, Desatoli, we have one I is impact, and then we do ICE. After that is, we have made the connection that is quite coherent. Then we ask ICE. So here it is his queries as well. This is his query as well. So that's why patient is saying, so this is impacting my life. Maybe you forget to ask and you ask like, what is your main query? And he's going to say, okay, doc, actually, I'm not coping with my daily activities. It's just quite difficult for me. And I feel embarrassed sometime. He can tell you over there. Okay. So this should be in your mind. Okay. And these flu-like symptoms, because this has very normal association with the flu-like symptom. When she had the symptom, and when you are going to ask, he's going to tell you, okay, when you are going to ask about the first time event, okay, the first time you came with what? She says, okay, I was feeling tired. Okay, how it started? It started after this and that. You need to explore that as well, okay? Because chronic fatigue syndrome, sometimes it carries some trigger factor, and after that, it is a long-term condition. We have to cope with it. Okay. So I have because in PLAB you need to there are multiple tires you need to have in your mind. For example, one thing is your clinical approach, one thing is stories. The stories should be in your mind as well. Okay, the patient comes with some stories and how you need to deal with that stories. Okay, Grapes, apologize for your PC is not working. How can I help you? Anemia, hypothyroidism, depression, PMMR, pain is the dominant symptom. Also in polymyalgia rheumatica, but you need to ask questions regarding that. Then there comes the chronic fatigue syndrome, and in chronic fatigue syndrome, whenever you have the suspicion, okay, you have ruled out all the things, these questions should be in your mind to ask for the chronic fatigue syndrome. Why? Because it has association with the chronic syndrome. Muscle pain, joint pain, headaches, sore throat, flu, any history of sore throat or flu-like symptom. You are going to ask this as well. For irregular beat, all that. You can ask any 2 or 3 questions out of them. Then there comes the systemic inquiry. I told you what is the systemic inquiry, because this is a very open-ended symptom. So you need to ask systemic inquiry. Then the red flag. Here the red flag should be 2, not 1. What are those? One is cancer, and other red flag is PMR. Polymyalgia rheumatica, you need to ask the question regarding any morning stiffness, any morning pain, any pain, aches and pain in your body, any problem with your combing of hair, because you need to ask this. This is red flag, because if the person having polymyalgia rheumatica, this is one of the red flags, because it's a serious condition. A chronic fatigue syndrome is not a serious condition. So you need to separate it from polymyalgia rheumatica. So you are going to do red flags for cancer and polymyalgia rheumatica. Keep in mind. Then PMA polyfamily desatoli. Okay, look, I have done this, like highlighted it with the blue color, because you need to ask. So ask about diet, alcohol, sleep. These are quite important questions. Effect of life is important, but you need to ask about the diet, because the diet can be cause of anemia, and it can cause bad diet can cause this problem. It can be vegetarian. Okay, there are some scenarios. It's not here though. In which the person is vegetarian. So you need to ask about the diet. You need to ask about the alcohol, because the alcoholic person always has the problem, can have the nutritional problem as well. Okay. Then sleep problem as well, because obstructive sleep apnea, you know that. Desatoli. So here the DESA is quite important. These PMA Holly family, because in the PMA Holly family, you are going to ask about every question is important in here. Why? Because you need to ask about any long-term medical condition. It can have any chronic disease. So you need to ask about that as well. Any medication, because there are a lot of medication, because the other scenario will come. Citalopram. The patient is having the depressive symptom and he's on the citalopram. So you need to ask all these questions. Then he's going to tell you. Otherwise, the tiredness is tiredness. Okay. Then the desatoli, you need to ask all these questions in DESA. So DESA is important, because all of them can cause what? Tiredness. Okay, let's then AIC. We know what is that. Anything you want to add? I is like, do you have any idea what's going on regarding your symptom? or any particular queries. Then comes towards the OET. OET is our examination, observation, examination, and test. Okay, observation, we are going to take all the observation, 4 things, 4 to 5 things it can be. Okay, then comes the examination of your heart, lung, tummy. I'm going to take your BMI, height and weight. Okay, you need to tell all this to the patient because it's tiredness. You need to take all this. Then perform the test. You need to perform a lot of tests over here. Okay, because all these can be cause of the tiredness, so you need to ask all these tests. You need to tell, I need to do the initial investigation, including your blood count, your because anemia is going to be checked over there, and then urinary electrolyte, LFTs, RFTs, glucose level, TSH level is quite important. You need to mention that the TSH level, because that's going to tell about the random glucose, IgA tissue glutamina, this is for the celiac disease. And then you need to perform these 2 tests, because you can say here as well, and you can say if you have forgot to tell here, someday people ask where we need to, because these are the special tests you need to perform. You can do here as well. And why are we performing these tests? Anybody can answer me my question, why we are performing these 2 markers? Now, yeah, infection, but yeah, exactly, it's a rheumatology. Infection you can, but typically we are performing ESR and CRP because of rheumatology, especially polymyalgia rheumatica. Yeah, exactly. So you are going to mention here. So the management, regarding the management part, clear onset of 4 months, nothing is helping your tiredness even after taking the medication, after taking the measures. I gather the condition is called chronic fatigue. You are going to tell your examination, your everything is normal. That's why we are labeling you chronic fatigue syndrome. Okay, you are going to tell in this way, because your history, in your history, nothing is remarkable. Everything is normal, and on your examination and on your investigation, everything comes normal if they give you some investigation. And this is, therefore, I suspect that you are having chronic fatigue syndrome. It is a functional. Then what we do in the diagnosis, when I say diagnosis, it's say diagnosis and explain. It carries 1 mark in the management. I have told the diagnosis, then I'm going to say explain what it is. It's a functional disorder in which multiple organ of your body become upset, because so you can explain in this functional disorder where the body becomes upset and start experiencing symptoms like tiredness and fatigue. There's no structural abnormality that caused this condition. The known cause is unknown. So this is the same you are going to describe the IBS. When you are going to describe the IBS, this is the same. So this is the functional disorder, this is the functional disorder. Okay, so there are other functional disorders as well, regarding the premenstrual syndrome. One is that another you are going to encounter other 2 or 3 functional disorder as well. So what we need to do, we need to do all the blood tests. These blood tests, we have sent you the blood test. We are going to get the report. If you are already sent, you're not going to say this. We are going to get the report, and we are going to decide based on that. So what you need to do is lifestyle modification. All you need to do is the lifestyle modification. Okay, its management is quite important. So there is no management regarding that. So only the symptomatic management and lifestyle modification. So you are going to say improve your sleep hygiene, balance between exercise and rest, CBT. It is quite important. You're not going to tell the CBT. I've just written CBT so that it comes in your mind. You are going to say talking therapy. This is the word that should be in your mind, talking therapy. Okay, so patient is not going to know about the CBT. You are going to say, so I'm going to refer you for the talking therapy, also called CBT. Okay, so some counseling session will help you in order to understand your condition and cope with it. So you are going to say this. Some counseling session will help you to understand your condition, and it will help you to cope with it. Then the energy management. They are going also, energy management should be in the same heading. They are going to like teach you how to do the energy management, because in this condition your energy is low. I have extracted this word from the NHS website directly. So you can say that energy management. Say directly. They are going to teach you how to cope with the energy management. Then after CBT is the sport group. So there are sport group for present, though there are some organization working on, but you need not mention the organization. You just say the sport group are there, so you can join that, because this is chronic fatigue syndrome is a long-term condition. It's not it's not going to away. So patient need to learn to cope with it, and it will improve by and by. Okay, so you need to tell that. And painkiller, if the pain is there, similarly offer the leaflet regarding this. That's it. You can you also mention that I'm going to refer you in the 6 months time to chronic fatigue syndrome service, but it is the 6 month time, no hurry. Okay, because in the 6 month time they are going to get time, because this is very long condition. Okay, so safety netting, any suicidal thought and do for the GCA. What is GCA? Joint cell arthritis. Any blurry vision? What is the question regarding the GCA? Any blurry vision, any tenderness while doing the combing. That's it. Both are enough. So suicidal thoughts, because the why suicidal thought? Because this condition is very depressing. The chronic fatigue syndrome is the depressing condition. Patient can have suicidal thought regarding that. Okay, suicidal thought or self-harming thoughts, or GCA. Why GCA? Because the polymyalgia rheumatica shares a lot of symptoms with chronic fatigue syndrome. So maybe you misdiagnose the polymyalgia rheumatica with chronic fatigue syndrome. So you need to do safety netting for GCA, joint cell arthritis. Okay. The second question, the second is polymyalgia rheumatica. I'm discussing a lot of things together, but because I want you to develop some connection in your mind directly, so you can interpret. That's why I have put all these scenarios together. Polymyalgia rheumatica, FY2 GP surgery, 67-year-old patient present with aches and pains. Aches and pains. It can be with the fatigue as well. Aches and pains. Take history, assess patient info. Pain more than 1 month. The pain on shoulder and hips. This is the typical scenario. Pain on shoulder and hips, because polymyalgia rheumatica is the systemic disease all around your body. It's not like rheumatoid arthritis, morning stiffness in these joints. It's not like that. It is systemic disease. Okay, it's all around your body. So it should be in your head whenever it's the polymyalgia rheumatica, because patient is going to say about, yes, I am having the morning stiffness. The morning stiffness is same in rheumatoid arthritis, but what is here is the systemic disease. Rheumatoid arthritis is systemic disease, not that systemic like polymyalgia rheumatica is. Getting worse, weight loss. Weight loss is very typical of polymyalgia rheumatica. So it should be in your mind. You should not be deceived with the cancer, because the cancer has all these symptoms, but do not get deceived with that, because it can have weight loss. Experience pain in the large joints such as shoulder, hip, also have the morning stiffness, but stiffness improves by end of the day. This is also very typical to the rheumatoid arthritis, but that is the small joint disease. It is the large joint disease. So this is the difference. Okay. Unable to do day-to-day activities. Okay, you need to ask this question. In any kind of chronic condition, the question is must. Any chronic condition, the question is impact on your life. It is must question. Also have the feeling of being tired. I also have the feeling of being tired. Okay. The pain is always the main symptom in polymyalgia rheumatica. Pain and aches around the body, stiffness. Tiredness is also there. But in chronic fatigue syndrome, tiredness is the main symptom. Pain and aches can be there. Okay. So do not get deceived with that. But bros, okay, everything we are going to ask about, I'm not going to describe this again and again. So what is your DD infection? You need to ask about the infection, because pain and aches can be in any infection. Do you have any fever, any flu-like symptom? The first question, because it's the very common, you need to ask very initially, because if you're not asking this question, you are going directly towards any morning stiffness. So they are going to get the idea that you have read that scenario. So it is smartness. You need to follow your line. So when a paper here, I have pain and aches in my body. You ask all the, you do like tupa, and after that, what question should come in your mind? Okay, any fever or any flu-like symptom, because this is the very much common in pain and aches. Okay, then rheumatoid arthritis, ask about the small joint stiffness, then rash, because this is all about you. And then must do systemic inquiry here. Always do systemic inquiry in here as well. Okay. Then the memory problem. This is very much also sleeping difficulty. This is very much common in polymyalgia rheumatica. This is going to give you very much clear clue. Weight loss, memory problem, concentration problems, sleeping difficulty, because it is the multi-system disease. So you need to do the systemic inquiry as well. So we have asked these questions regarding, because they are going to answer all these questions during my two-part questions. Then I'm going to do my DDs, and then this is the rule in questions. What? Memory problem, any concentration problem, any difficulty with sleeping. Okay. So what is the red flag in here? Again, GCA is the red flag in here. Okay. GCA is red flag here. Ask a very clear question. Any eye problem, any problem with your vision, any headache, any problem while chewing. This is the red flag. Why it is the red flag? Because whenever there is a suspicion of GCA, you always do injectable steroid first and then refer. You do not wait, because this is because you send it to the ophthalmologist, but before that you inject the steroid. That's why it is this scenario is going to come later on, the GCA scenario. That's why I'm going to give you in mind, because it's the red flag. So you need to do the red flag over here. Okay. Ask all these questions in the history. Then again, ask about the weight loss, tiredness. That is the cancer questions. Chronic fatigue syndrome, you need not to ask any question, because they are telling only. Because there is no question regarding the chronic fatigue. Only if you ask all the questions, then you need to ask 1-2 questions regarding the chronic fatigue. Otherwise, there is no question for the chronic fatigue syndrome. Okay, we have already asked these questions. Then do your PMA, Holy Family effect of symptom. Anything left? Why I say again and again, anything AIs. Why I see again and again, say again, because sometime you need this. Sometimes you forget to ask some question and examiner is waiting. You should ask this question, because they are quite cooperative, and you do not ask and he is not telling. And then you say, is there anything else I need to know which has not been discussed yet? Most probably examiner will say this. Okay. And it can save your exam. So always give importance to this aid. OET, I would like to do GP examination of your shoulder, hip, eyes. Eye examination is quite important here. Never miss the eye examination. Say fundoscopy, say eye examination. Don't say fundoscopy, eye examination. Okay. Because he's going to know that why you are doing that, because in polymyalgia rheumatica, if you are not ruling out GCA, this exam is failed. Trust me, if in polymyalgia rheumatica scenario, you have not asked questions and you have not kept in your mind the GCA, joint cell arthritis has very strong association with polymyalgia rheumatica, this scenario is failed, because they want you to be the safe doctor, not the well-equipped doctor. They want you to be the safe doctor. So this is the safety measure. You are asking in the polymyalgia rheumatica scenario, you are asking about the GCA, joint cell arthritis questions. Okay. Management. Explain from the history and examination, finding what they have told me. You just 1 or 2 things together, put them together, because you have the morning stiffness, you have the pain in your shoulder. I suspect that you are having the polymyalgia rheumatica, and this is the swelling of your muscles and joint. Okay. So what decision you are going to do? I'm going to run some tests. What are the tests you need to do? Okay, let me see where it is. It is GP surgery. So you need to run some test, and if it's a GP surgery, you for that after doing the baseline, because all the tests you cannot do, you need to refer the patient for the further testing. Okay, because it's require more tests. However, these tests you can do, all these tests you can do over here, ESR and CRP. And if it's because a polymyalgia rheumatica scenario, it does not require immediate treatment. Okay, because it is not the GCA. If you have ruled out the GCA, then what you need to do is you need to do all the testing. After that, you need to tell the patient if that you're weak, because on the testing you are going to convert, because you need to give the steroid, and steroid should be given for a very long time, and you cannot put the patient on steroid without having the confirmed diagnosis of polymyalgia rheumatica. So the next question will be, they are going to ask about the steroid side effects. So here are they. Here are the weight gain. So what you need to do is exercise, watching your diet. So here are the thing you need to do. Weight gain, uske liye, for that regular exercise, regular sugar monitoring, because it can call diabetes mellitus. So what that you need to do is taking sugar control, and you need to do is you can take the medication, regular monitoring of your blood pressure, because it can raise your blood pressure. Similarly, it can cause ulcers, so you need to do the medication for that. Similarly, it can cause osteoporosis. So these should be in your mind, and your answer should be with that. So be very quick in that, and be very, very smart. So it can cause what? Weight gain. For weight gain, say the question. You need to do regular exercise, and you need to do the lifestyle modification regarding your diet. Okay. Similarly, diabetes mellitus, for that you need proper monitoring. Similarly, blood pressure, ulcer, osteoporosis, and there the questions are given. Plan after the test result will come 5 to 7 days, we will start on this medication. Okay. So you have sent for these tests, and you need, what you need to do, another appointment. So this is important. This is important part of this scenario, another appointment. So after a week, you will do another appointment. You come, and we are going to do the we are going to discuss the test, and then we are going to put on you steroid, because the steroid is the mainstay of treatment for the polymyalgia rheumatica. Safety netting, again about GCA. Okay. Second,
वो वेट गेन होता है ना, इसके लिए वॉक जरूरी होती है। हड्डियां वीक होती हैं, ऑस्टियोपोरोसिस है, इसके लिए वॉक जरूरी होती है। शुगर ना हो, इसके लिए वॉक जरूरी होती है। इसके लिए वॉक करते हैं।
okay, so next question. Next is again the tiredness. Other scenario is again the tiredness, and it is with the citalopram. Tiredness due to citalopram. Okay. A patient, 55-year-old lady, come for the follow-up. She has the depression 4 months ago and started on citalopram 3 weeks ago. Blood test is given. Sodium is here. So it is very clear scenario. So this tiredness is due to citalopram, but never assume. The answer to this question, the why this patient failed, you assume. Never assume. Because I have seen sodium is 128, because it should be like around 140. So for me, it is this is the reason why these kind of scenario fails, because you always assume. Okay, sodium is low, but can't the tiredness because of any other reason? So the answer for this type of question is never assume. Okay, so again, you will start this scenario how 4 Qs. Here you will start 4 Q, because why? What made you to do these tests? Why she did this test? Okay, and what she was told, again 4 questions, and then you can explain over here, or you can, this by your choice, you can ask, okay, your sodium level is low, but you can do another way. What is the other way? You can say, okay, my results are with me, your results are with me, we are going to discuss later on, but I need to ask a few more questions, and so that I can be in a better position to answer your queries. Okay, then start taking the history. And what history should be? Tiredness. What history should be? Tiredness, because the patient says I'm having the tiredness. And what are the history of that? 4 DDs, 4 to 5 DDs, systemic inquiry again. Okay, then because in this scenario, first of all, you need to take history of depression, very small history, because patient says the depression, he's having the depression. Take a very small history regarding the 4Q, regarding the depression. What symptom were you having? What you were diagnosed since? How long you have been this? Ask the question regarding depression, and then this rule in question. These are the rule in question. You always forget this, because these questions are actually the hyponatremia, because one clue is given over here like this. It's 128. So you need to ask this question. Any nausea, vomiting, headache, confusion, restlessness, irritability, muscle weakness, weakness is okay, and seizure. any episode of seizure. Because why I'm asking these questions? Because while doing the management, there are 4 types of hyponatremia: mild, moderate, severe, and very severe, life-threatening. So these symptoms with the sodium value, we determine which, and the management is entirely based on these symptoms. So you need to ask this question. If you have not asked this question, okay, the sodium level is 128, the patient says, okay, I'm confused, and you are saying, okay, you can go home. The patient say, I'm feeling irritable, I'm feeling restless. Okay, the issue is in the clue, and you have not asked this question, because the moderate and mild with symptom requires admission, and the patient with mild symptom or with the mild category, for example, that is the here it is the value. I show you the value: 125 to 33. It is the mild hyponatremia. You can send home. You can send this patient home. You can manage this patient without admission. However, all these patients need to be admitted. However, patient with these symptoms, the mild hyponatremia with symptomatic, need admission as well. So that is why you should know why I'm asking these questions. Why I'm asking about the nausea, vomiting, headache, confusion, restlessness, and muscle weakness. Okay, in this scenario, okay, I'm repeating this scenario. Patient comes, you have the value there, and it's the depression. You have asked very small history regarding the depression. You have asked about the 4 Qs, and then you ask direct rule-in question. What are they? Hyponatremia question. Why the rule-in question? Because the value is given. However, after doing that, never forget to ask these questions: other causes of hyponatremia, because hyponatremia can be due to citalopram, but it can be due to any other reason. What are they? Vomiting, diarrhea, problem with urination, any medication, or any medication you have asked about, too much water, or any ecstasy pill, because in all these kind of scenario can cause hyponatremia. So you need to ask other causes of hyponatremia as well, and then you need to rule out anemia, hyperide, and depression. Why? Because the patient can have any other concern. Patient is hyponatremic, he is tired, maybe he's not having the symptom because of hyponatremia, he can have the symptom because of the hypothyroidism. Most probably they are not going to complicate you in this way, but if you have asked all these questions directly, they are going to give you a bundle of numbers. Trust me, because you have asked all these questions, you are telling that I'm not coming with the templated approach, I am exploring everything. So that's where they give you maximum number in your data gathering. Okay, so you need to ask about any diarrhea, anemia, any heart racing, any heart racing, any shortness of breath. These 3 you need to rule out. Then complete PMA, Holy Family, Desert-Oli. The question you have not asked already, you can ask over here. Again, similar. So I have already told you regarding the management part. Regarding the part of the management, we have talked already. So decision should be made on what is his value and what are the symptoms. I have given that below. You can read that, because I just have copy paste from the NHS website. So it's not directly written, but I have copied. There was some document over there, some PDF document I have copied from there. Explain the diagnosis. Low sodium is most probably because of the citalopram, because it has. So I am going to stop this medication and going to prescribe you alternative medication. This is a very much important thing. I want to mention it with you. I want to discuss it with you. Why? Because actually antidepressant medication, the GP has the power to write. The GP has the authority to write. GP can write antidepressant medicine. GP can treat depression. Okay, so sometime the patient is taking, because who prescribed you the medication? Okay, when you were taking history for depression, you have asked, since how long? What were your symptoms? Who prescribed you the medication? He says, okay, GP, another GP. So you can change the medication because the GP has prescribed, so you can change. But if you say, okay, it was the psychiatrist, so you cannot prescribe that. Keep in mind, then what could be, you need to book a referral to a psychiatrist. So here comes, this is the management. Actually, the telling, the medicines is not the management. Management is, you should know about the system. The system is that if the GP has prescribed, you are the GP. So because you are the GP, you are FY2 in the GP. So you can say even, okay, after the consultation with my senior, we need to change the medication, because on the GP surgery, even then there are seniors. If you are FY2 level, so you can tell that, okay, we are going to prescribe you after consultation with my senior, I'm going to change the medication to amitriptyline. Or you can say, if it is, because that is why it was important to take the history of depression. I told you take a brief history, because here it is needed. Okay. So here you are going to say, okay, if it is by the psychiatrist, I'm going to make a referral in 2 week time. Meanwhile, you have to stop this medication. By any chance, you have to stop this medication. Okay, and otherwise you can prescribe by yourself if the GP has written. Meanwhile, restrict the fluid intake. This is again very much important. You can go home and meanwhile restrict the. Why I have, because he's not having very severe symptom, any severe symptom. Secondly, he is in the mild category. If it was in the moderate category, I should send it to the hospital for management. Okay, because then some hypertonic saline should have been given. Okay, you need to repeat okay, then what you need to do is another booking. You need to do another booking. Just a minute, I need to mute the mic. Asmatullah, your mic is open. I'm going to mute it because it's disturbing. Okay, here the thing I have talked about are written over here. You can go and just read. If who need, read only this. Who need to be admitted, who can be managed in the primary care. These are all the patients with new onset hyponatremia should be repeat NH check after 1 week. So what should be over here? Booking 1 week. 1 week booking is required. So this is important part of, because you have asked him, because he's not having any symptom, water restriction and medication change. So patient is going to ask a question to you. Will the new medication cause the tiredness? It can cause tiredness, but not very common if you have the tiredness symptom or not that severe. Okay, so you will answer this to the patient. It can be his concern. So these are the theoretical framework which we have already talked about. So here comes another scenario with hyponatremia and COPD. The same scenario will be the same. I'm going to discuss it in a very fast way. GP surgery, FY in the GP, 60-year-old, blood test, he is COPD, blood test are normal, except sodium level is very low. No, it is very low. No, we have already talked about. So what should be done? Okay, anybody? So seeing this value, what need to be done? You are in the GP. Yeah, no, admission, no, it's referral, because you are in the GP, where you are going to admit the patient. It's urgent referral to the emergency. Yeah, in the patient management, yes, you are going, but what should be your decision? You should, because what we do in our management, explain the diagnosis, decision, then we do the target management. So our decision is here to refer, and there we are going to tell about the targeted management. Okay, similarly, we have talked about these questions, rule-in question regarding the hyponatremia, rule-out question, because it is the lung cancer, because COPD, basically it is having the condition. Why this is having the hyponatremia? Anybody can tell me why? COPD patient, why is having hyponatremia? Where we can get the clue regarding the history? Anybody? I'm waiting. Why this patient is having hyponatremia? COPD patient in here, why is having hyponatremia? Exactly. This is SIADH, paraneoplastic syndrome. It is regarding because he's going to have the lung cancer. exactly because of that. So whenever you need to ask all the history, because the essay is having hyponatremia, but you need to ask all these questions. You need to ask any long-term medical COPD. Okay, you need to ask about the smoking. You need to ask. So here in the management, whenever you come in the management, it is important thing I need to mention here is the suspected cancer approach, because the patient does not know that he's having cancer. So what you gonna do is suspected cancer approach. What is suspected cancer approach? Dr. Adil is going to teach you in a very elaborative way. Suspected cancer approach is when you are going to disclose the patient, because here regarding the management, you in the OET you will say that I need to examine your chest, I need to do general physical examination, observation and all things, and initial test, chest x-ray. You are going to do all that. After that, in the management part, you are here, your results are with me. The sodium is quite low, which is causing the tiredness. First, you told about his tiredness. Second thing, here are two diagnoses, not the one diagnosis. One is low sodium is causing tiredness, and second diagnosis is cancer. So you are going to adapt a suspected cancer approach. That is like, you can use your own language, but it is like you have to give the warning shots. Why? Okay, the patient comes with the similar symptom, can be due to simple condition like infection or anything. However, in certain cases, it could be a very serious condition, like it can be due to, I'm sorry to tell you, it can be due to cancer. So you need to give the warning shots while interacting the patient. And after telling that, you need to be quiet for a while. This is what suspected cancer approach. It is not like the cancer approach. There's a difference between cancer approach and suspected cancer approach, because telling the cancer approach is breaking the bad. It's not the breaking the bad, because you are having suspicion. You are not like, you cannot tell by certainty that you have done all the bronchoscopy and everything. You are saying that it is cancer. So it is the suspected cancer approach. You need to learn about, you need to have a very strong grip on these approaches, because these approaches you are going to replicate. Whenever there comes such a case, you are going to replicate it. Okay. I'm a bit concerned about your symptom that you have. The reason for my concern is that you have been coughing for some time. Your sodium level is quite low, and you have been smoking for a very long time. You have started blood in your cough, because when you are going to ask about his history of cough, he's going to tell you about that. Unfortunately, I'm sorry to tell you, Mr. Johns, your condition could be. Always say your condition could be. Never say it is, because it could be. Okay, it could be cancer. For that, what you need to do is you need urgent referral. So what is your decision? Urgent referral. So first, you need two referrals. One referral is to the emergency. The second referral is to the cancer specialist. Why? Because you are going to make one referral is to emergency right now. Okay, because the sodium need to be corrected. Okay, the second referral is within a 2-week time. That is called the urgent. Immediate referral in this system is immediate, right now. Now go. Okay, and the urgent referral is here for 2 weeks, within 2 weeks time. Okay, so what they are going to do is they are going to do certain investigation, bronchoscopy, CT scan. Then you can talk about, depending upon your diagnosis, involve the patient here. Keep patient involved in that. And your safety netting is you're waiting for the, especially your symptom get worse, you come back. Okay, these are two safety netting. One safety netting is problem with the appointments. Then any symptom worsen again, you can come back. Okay. So here we have talked about the tiredness approach. Other tiredness, I think it's gonna come in the scenario of depression as well. So we are going to deal in the one scenario over there. It can be due to sleep problem. It can be in the psychiatry session. So this approach is done. So next approach is our fall approach. The second approach, it is very much common again. Okay, actually I have got the scenario from the fall approach in my exam. So I tell you which scenario was that. Actually, fall approach, you need to learn about the fall approach. The key words for the fall, if the patient say, I fell down at home. So these are the questions before, during, and after. So the classify similarly, like we talk about the jaundice, we have approach in our mind, pre-hepatic, post-hepatic, and hepatic. Similarly here, the question should come in our mind should be before, during, and after. Okay, so before collapse, there are a lot of questions given over here. You need to learn, you need because in this because I have given some feedback that the student get problem with asking the question. So I have put the question for you guys, so you learn these questions. You can make your own questions which are on your language. Did you feel what always ask an open-ended question? The first question should always be open-ended. What were you feeling before? He might be telling you, he might be telling you like open answers, so he that might save your time. Did you experience any warning sign, nausea, any abdominal pain, lightheadedness, blurry vision? Ask all these questions. Okay, any headache, any chest pain? These are the common questions. You ask all of these questions, and each and every question carries some DD, but you need to learn that what question should be asked before the collapse, then the precipitating factor. These are the, what were you doing? The most important question, always describe me the event. Before asking any question, describe the event. Describe what has happened. Maybe the patient is going to tell you a lot of questions by himself. A lot of answers is going to tell you, but actually I was watching TV and then suddenly I fell down and I was having a smell, and all these kind of questions, they are going to always ask open-ended question. The first question should be open-ended question that you ask before the collapse. These are the precipitants, any trigger, you can ask all these questions. Okay, during the collapse, were you conscious? Remember you falling onto the floor. Remember urinate during the collapse. Do you remember what happened during the collapse? Did you lose your consciousness? How long you? These are the questions like during the collapse question. Then there comes you need to rule out the epilepsy. These are the epilepsy questions. So always ask these questions as well. Did he because the fall always not is the patient there, sometimes the relative is there, so you can ask, you ask the patient because the relative is with the patient is there. You need to ask these questions to the relative because the patient is unconscious. So did he experience jerky movement, any bite in the tongue, frothing from the mouth, eye rolling, stiffness of the body after collapse? These are the after collapse questions. How long it take for you to come normal? Were you confused? Headache, weakness? Okay, then number of episodes, you need to ask these questions. These are the fall questions. Always the patient, you do not get worried that you need to ask all of these questions. Just make an idea you are going to ask these are questions. Okay, yes, you need to ask the urination question after fall. It is in the after fall. Here, after collapse. So urinating question you need to ask in after fall. Okay. Then it comes towards the differential diagnosis. You just give a read through this. That's why I have made to blue color. Just give a read through this. What are they? Okay, here are the differential diagnosis. I'm going to tell you about the question you need to ask, because the differential diagnosis, you just give a read through that, because there are a lot of them. Hypoglycemia, always ask a hypoglycemia question because it's the dangerous most. Okay, collapse patient comes to the emergency, always ask the hypoglycemic, do you feel hungry, sweaty, like shaky before fainting? These are the, you need to ask always. Hypoglycemia, the stroke question, any weakness? Yes, you should ask the trauma question. This is actually the trauma question. Okay, this is just I need to tell you because there are a lot of questions the student can get confused because of that. I cannot ask that a lot of questions. So you just need to memorize some of them. Otherwise, you are going to ask them in the DD as well. The question you are forget to ask in before, during, and after question, you just get the idea what need to ask this and that. Otherwise, you are going to ask in the DD section as well. You forget to ask question, you can ask here. Trauma is very much common DD, so you need to ask about the trauma. Okay. Here, otherwise I should put epilepsy. You need to ask the epilepsy question, one or two. You need not to ask all of them. You can ask one or two. Other are the question you have asked about the headache. Because you asked about the headache, it gonna rule out a lot of questions. It's gonna rule out meningitis. It's gonna rule out subarachnoid hemorrhage. So it's gonna rule high blood pressure. So always ask about the headache. Always in this question, collapse question, ask about the headache. And then you need to ask about the aortic aneurysm. Then the cardiac cause, always ask about the cardiac cause. What question can I ask? Do you have any long-term medical condition? You can ask this question in that. Any problem with your heart racing? Okay, so you need to ask about any previous history of myocardial infarction, any chest pain. So you need to ask about the cardiac problem. So I have given these questions so that you can read these questions. Otherwise, we are going to discuss in the scenario. That would be a way more easier for you. Here it look like a lot of things. How can I ask a lot of things? You need not to ask a lot of things. You need not to rule out only 4 DD. Before, after, and during. Before, during, and after question. After that, epilepsy question, and after that, 4 DD. That's it. It's just for the reading purpose. Do not get confused for that. And what are the red flag for this? Meningitis, stroke, and MI. Meningitis, stroke, and MI. This should not be like, you cannot forget that. Severe headache, blanching, weakness, any part of body. This is for the stroke. Any problem with like what is the problem with your talking? Central chest pain, shortness of breath. These are the MI. So these are the red flag for this. First fall scenario, fall in elderly patient, heart related. This is the heart related patient. FY an orthopedic, FY2 in orthopedic, 72-year-old, 5 days ago with a hip fracture and hemiarthroplasty has done. He's fine. She's fine now. Consultant asks you to go and find out the cause of fall. Please assess the patient, discuss the initial management. You need to take all of the history, because which history? Fall. So he must have some fall, because that's why he has undergone hip replacement. Okay. So she's on antihypertensive medications. She had 3 falls in 6 months at the time. Studying breakfast, sudden fell. And this is the all history you need to ask before and after question. First of all, regarding the fall, you need to ask again. You need to ask about the event, how that has happened. Here she's going to tell you how this has happened. Then you need to ask before, after, and during questions. And after that, you need to ask about the DD questions. So here it is: initial, before, during, after, hypoglycemia, stroke, vasovagal. Because what is the question of it? What you're doing, any strenuous activity? This is the vasovagal, because you can ask that. Again, the trauma question should always be there. Never assume that it is easy. I should assume that trauma can't be. Trauma is there. Always trauma is there. Trauma is always there in the fall scenarios. Okay. So always ask about the headache, MI and pulmonary embolism, heart problems. So these are the DDs for the fall. You just need to remember these DDs for the fall, not all of them. Okay. Introduce yourself. Then like do the grips, ask about the fracture, ask about the event, you ask about all the questions, then do your DD. We have already done. And then PMA Holy Family Desartoli, complete that. Effect of the symptom, because it's I'm going to remove from here, because no effect of the symptom here. And here, very much important here, the thing you should never T for traveling, OL, occupational and living condition. Never forget this. Do you have any idea why I should never forget occupational and living condition? Why should not I forget? Because if you have not asked these two questions in this scenario, I assume they are going to fail it. Why? Anybody? Why occupational and living? Who do you live with? The two questions: occupational, what do you do for living, and who do you live with? These are two OL. Why these are important? Anybody? You can open your mic and can answer if it need a longer.
For abuse, I have
The employer need to be informed, okay, to make a referral to safeguard services. Okay, this is important, but I'm asking about it's occupational. But why it is? Who do you live with? Why it is important? Because it is a way more important for that. Yeah. Because you are going to discharge the patient. Because you are going to discharge the patient, and you have not asked about the living condition in a very good way. It's not only one thing. Who do you live with? Tell me about your living condition. You need to explore that. How is your home? Okay, because in UK, the person who are in UK are this is very common. The person living downstairs and the washroom is on the upstairs. So you have not asked about that. The patient with the fracture and hemiarthroplasty has already been done. So you need to ask, who do you live with? He's living alone and you are sending the patient home. Okay, he's going to come back with another fracture. Okay, so you need to explore that during the history in a very appropriate way. Exactly, occupational therapist and care is required or not, if the patient requires care. So it's not the only, otherwise we ask only question, who do you live with? What do you do for a living? But here you need to explore that. Who do you live with? Patient say, okay, I'm living alone. Okay, and or she says, okay, I live with one. Okay, who take cares of you? If she says, patient says, I live with the person, I live with my husband, and and you have not asked about who take care of your husband, who will going to take care of you, and patient going to say, actually, I take care of my husband. Okay, so you need to explore this. The patient is the old age patient, a patient living with her husband, and you are not exploring this, because in this, it is a way more important that you need to be safe. To be safe in the discharging patient is important to ask about their living condition. Always, you are going to discharge the patient. What should come in your mind? Living condition. Who is taking care of the patient after getting discharged? So, okay. So is that clear why this is important? So while taking the history, because we have a mnemonic that I called a very much great mnemonic, PMMA, Holy Family Dysautoly. So I always try to tell you like very important point which you should never be missed in a particular scenario. In this fall scenario, this should never be missed, and particularly if you are going to discharge the patient, it should never be missed. Okay. Okay, then again, OET observation, taking the people while lying and standing position. This should come out from your mouth directly. I'm going to take your blood pressure in sitting and in upright position. It's not standing, because you cannot do the standing position. It could be upright. BP while lying down and upright. Because you are actually ruling out the cause. So you need to ask all, you need to rule out all the causes. Okay. Because while you are taking the history, they're going to give you the clue is taking antihypertensive while doing the breakfast. The husband, you lost your conscience for a few minutes. Your husband called an ambulance. Very feeling you were going to fall happened suddenly, occasionally beforehand. Because here it is quite important that you should tell the patient the cause is not clear. The cause is not clear, because nothing in the history is that can direct you towards any cause. So cause is not clear. So what should be your answer? We need to run a few more tests. I need to consult my seniors. I need to consult my seniors. We need, so whenever the cause is not clear, these two questions should, these two answers should be on your tongue. One, the cause is not clear. You should tell the patient. Don't worry about that. You are not telling the exact diagnosis, because I have seen in my experience, we can pass this exam even with 10 marks out of 12 without telling. I got 9 out of 12 in one scenario. I couldn't tell the diagnosis. I think two diagnoses I couldn't tell, and both are them passed with a high score, because I put my effort and they give me the number. Okay, so here you are going to tell, it could be, you should tell it could be because of any reason. Still, I'm not sure, because they are going to give you the sitting and standing blood pressure normal. Everything is normal. So what you need to do is you need to do the ECG. You need to take all these observations, ENT, chest, initial test, all the initial tests, and then you are going to explain it is not clear. So we are going to some investigation. It could be due to any reason. So you need to do a lot of investigations regarding ECG, your echo. This is the targeted. And for that, you need to involve the senior. This is where, oh no, this is in orthopedic. So you are going to send call for, you are going to send call for medicine department, or you are going to send call for cardiac department. Okay, because the targeted, I'm going to involve the senior. We are going to run some tests, ECG, X-ray, echo, monitoring blood pressure, and all. You need not to say this, because we have already said that. A cardiology review. Cardiology review is quite important. Cardiology review. And maybe we need Holter monitoring. Say need ambulatory ECG monitoring. So this is quite important, because this could be any arrhythmia. So it's not, you cannot catch that just because just only you done the ECG, and arrhythmia cannot always be detected on ECG, because atrial fibrillation can be detected, but there could be any other abnormality that can be ectopic beats or anything. So you need Holter monitoring. But to the patient, you're going to say ambulatory ECG monitoring, in which device will be given to you, and you will bring back the 24-hour recording. Okay, this is the way you need to tell, and then do the safety netting as well. For what? C, VA, and MI. Do the safety netting for that. Then there are other causes: fall in elderly, postural hypotension, acute cause mechanical. This scenario I got in my mock test. I couldn't pass. This was the mechanical fall, because I had never heard about the mechanical fall word, because this was the first time I encountered in my mock test. I gave a mock test over there. I got this scenario. I couldn't pass because I couldn't rule out the cause, because in the, honestly speaking, if it was the exam of the GMC, I could have passed that, because in the mock test they want you to talk only what they want to listen, but in the GMC they don't do that. They really appreciate your effort, because in the mechanical fall scenario, okay, the scenario is that FY medicine, 75-year-old lady admitted due to fall. Doctor have performed some assessment, and blood pressure sitting and standing is that, because this is already given. So never do that again. This the most common mistake the patient do, the student do over there, is they have given the scenario, and while doing the examination, you says, okay, I'm going to do the blood pressure monitoring in the sitting and standing position. They have already given you the reading, and this is where they got you templated. So they have given you, that means this is not, because 20 fall of 20 is significant. This is not, this is less than 20. Okay, this is 14. ECG, blood, everything is normal. All the findings are given. Okay, while taking the history, they have a 4-time fall, and in full fall that was doing the gardening. Second time was trying sitting up position, and the third time cannot remember. Then fourth time it is now. So you need to ask the four, briefly ask about the 4 event, And the last one should be asked in a detail. Okay, not the previous three. Ask about the last one in a detail. And then again, you follow your approach before, during, and after. Ask your DD questions and PMA Holy Family Disorderly, because in this scenario, you will find a lot of problems in it, because it is the patient actually, in this patient, the patient has the multiple fall. Actually, he's the weak. His muscle mass is weak, actually. So here it is, he's not having any problem. He's getting fall because of his age, and because of his other problem, because of his other health related issue, he's falling. So you need to ask all the question, complete the PMA Holy Family Disorderly. Okay, on examination, do not do the examination till it's already been done. Do not do the examination, because it is being done, everything is normal. X-ray and examination has been, because doctor performs some assessment, the assessment has already been done. So don't do that, they have told you. So management diagnosis, you will tell that this is because of the weakness. This is called the mechanical fall, because it is the weakness of your legs, because you are falling again and again. Tell that to the patient. Okay, so what is your decision? Decision is that this is management. Actually, you need to refer to the occupational therapist. Again, you need to ask the same questions I have told you about the occupational health, about about the occupation, about his living condition. You need to ask all these questions. Then you would be able to tell that I need to refer you to the occupational therapist. What occupational therapists do? They made some changes at your home. And what physiotherapist will do? That will do some graded exercise to strengthen your muscles. Okay, you need to tell that. And then if nobody is going, look, this is very much common. You need a physiotherapist, occupational therapist, and the third one is social services. You will be needing that in a lot of questions. You will be needing them. So you should know what social service do. They will provide some care. They will take care of your social aspects. Okay, while physiotherapists do, they made you some graded exercise, some exercise. And what occupational therapists do, they can make some arrangement. For example, if the patient is having the trouble with going to the washroom, they can arrange some at home. They can do some changes that could be beneficial for the patient. Okay, so always involve them in such kind of scenarios. Okay, if the patient needs help, for example, in the other scenario we have talked about already, we will be needing occupational therapist, we will be needing the fall scenario. These three things, physiotherapist, occupational therapist, and social service will be required. Okay, do you think this fall I have is because of the hip replacement I had 4 months ago? No, because X-ray is normal. So you will say because the X-rays came to be normal, so it is very less likely it's because of that. Okay, do you think I will be walk again? Yes. If we will be, it's not you say you should walk, be able, you will say, okay, we are going to work in collaboration with physiotherapist and with your GP. Because here it is, which ward? It is in medicine. Okay, so here with your GP, we are going to work in a collaboration, and it will strengthen your muscle, and you hopefully you're going to walk. Okay, this should be the answer. Okay, then fall on ward hip fracture. This question was in my real exam. I think it was that one in my real exam. But it was on the telephone. I hope Dr. Adil has made you to learn the telephonic conversation, because any station can be on the telephonic conversation. Just for example, okay, I should repeat it for you. You need to confirm the identity of the patient. If the patient is not there, if the relative is there, relative, to me it was the relative talking. I was much scared regarding this station. I couldn't do well. However, I passed this with the 9 marks, because actually the problem happened because I could not read the instruction, because there were a lot of instruction. That was such kind of scenario. The son has to talk for her mother or son, and actually I couldn't get that it was the video call. I thought that it was the telephonic conversation, but after 2 to 3 minutes I got the idea that the patient, the son is in front of the the TV. So anyhow, I try my best. Then anyhow, I managed to pass this station. Okay, so I'm just telling you how to do this approach. First of all, you need to confirm the identity. Then you need to confirm the relation. You need to confirm the person, the whom you are talking. For that, you need to ask about, can you confirm the address for me? Okay, then you need to tell if the call get disconnected, should I call on the same number? So don't get worried. This is like half a minute you are going to get through these questions. Then you can jump. Then you can start your conversating regarding any. This is the only thing you need to know about the telephonic and video conversation. Otherwise, okay. 65-year-old with pneumonia, successfully treated, ready to be discharged. Physiotherapist has reviewed today. Filed down while going to the toilet. Asked to come and review and address her concern. You had chest infection, better now. Again, 4 questions you need to ask about the 4 questions. You live with her husband. Again, the same thing. Okay, look at here. You live with her husband. Husband had got the Parkinson's disease. I have talked about this. That, okay, you ask, who do you live with? I live with my husband. And you assume that, okay, the husband is there. He's going to take care of her. And you have not asked about who is going to take care of you. And she's going to say, okay, actually, I have to take care of my husband because he's Parkinson. He's having the Parkinson. Never assume the things. Always, whatever the question queries comes in your mind, always say that. Okay. So your husband got the Parkinson disease. You want to go to home. You want, actually, this is your query because the patient has got the fracture and she's saying, I need to go home because this is actually the counseling station. This is not the medicine station. This is actually the counseling station. Okay, we are going to discuss about how we are going to deal with this. Again, paraphrase that, ask 4 questions, ask about before, during, after questions. Similarly, ask about your DD. Complete all that observation. You are going to do the neurological examination, examination of heart and lung. This is for all fall stations. Examination of lung, heart, general physical examination, and here typically examination of your hip, because the fall history. When you mention, the examiner will give you, there's a tenderness in the groin area on the left side and limited movement, mild kyphosis. This, if you are not going to say that, and what you need to do is, the X-ray. If you are not going to say, patient is not going to give you anything. So hip examination and X-ray, these are the, you are going to say that. And in this, I'm going to repeat again, social history is quite important. In all fall scenarios, we have discussed the 3 scenarios. Social history is important. You can see the social history is quite important in it. Okay, then the management. I have just examined your hip. You have some pain. Unfortunately, this possibility is the fracture. Okay, then what is your decision? This is, you are telling them, explaining the decision, diagnosis. Then decision, we need to perform some X-ray. You can say X-ray above. And if it come to be the fracture, we need to admit you, and because you are where, let me have a look. No, it is the medical unit. So you are going to refer to orthopedic. You can say refer, and you are going to send call for the orthopedic, anything. Okay, because the hip fracture need to be, the patient here, the patient concern will come. Actually, I want to go home because my patient is, my husband is there alone and he's having the Parkinsonism. So I need, so here you need to counsel the patient. You need to counsel this. I can understand that your queries are quite genuine because your husband is there. So what we can do, so only not, you need to appreciate the concern like we do in OET. We need to give the solution as well. What are the solution? What we can do is, we can arrange, I can contact the social services, and they are going to manage something for your husband, and you need to get admitted. And after that, you need to ask about his home condition as well. So the occupation therapist can be invited. And after that, tell the patient you need to get admitted and you need to get fixed. And after that, you will be requiring the physiotherapy as well. Same, the fall scenario have the same. I'm repeating that because that things come in your mind. Perform ECG. That is the thing you need to do in every patient with the fall. Fall with hand injury. This is a bit different scenario. This is not the similar we have already discussed, a bit different. actually it's the fall scenario, but it's the accident type of scenario. In emergency department, a 40-year-old patient brought after a fall. Take the focus is to assess the patient, relevant examination, the patient information. You went out with your wife, 2 children. Do not remember what has happened. Actually, what you will do before, after, and during fall questions, and you will be doing your DDs. Alcohol is quite important in the fall question. Every fall question, alcohol is quite important. Diet is quite important. You drink alcohol, but not that much. No recreational drug use. Ambulance brought you here. You vomited. This is important. If the patient says you vomited in the ambulance, that is one of the danger signs regarding fall, because it is toward the head trauma. No weakness in the body, projectile vomiting. At the moment, generalized headache. Okay, so you need to ask questions. Then these are the when you will be reaching to this part, they are going to give you the answer of these questions. But again, similarly, after approach, then you will be asking all these questions. Red flag, head injury question. You need to ask a head injury question, because you need to ask about the event. What are the head injury questions? What can be the danger sign of head injury? Everybody of you knows about that, like any discharge from the ear, from the nose, any vomiting, any loss of consciousness, any seizure. You need to ask these questions, because these are the danger sign of the head injury. Okay, then we are going to do GPE, GCS. GCS is quite important here. The patient, because here this is actually this is the head trauma scenario. This is the fall with head trauma. So you need to do the GCS. You need to do the fundoscopy, eye examination, neurological examination, cranial nerve examination, ear examination. Why? Because some ear discharge can come out of that. Because here, I think here it is written, the ear discharge. No neck streamness, colorless ear discharge from the right ear. So it is no, it has become the dangerous thing. Manage diagnosis. Most likely, this could be you have the head injury. Don't say it's severe head injury. I think it's the head injury. It could be there could be, but you all do not say with the affirmation. Always you suspect this. You are suspecting this head injury. For that, you need some investigation. Don't say you are having this. Always say, because you are the junior doctor, this is a very serious condition. You can say you suspect this. That's why we need to do certain investigation. What investigation? Obviously, it is the CT scan of the brain. Okay. And after that, if the patient is having pain, or offer the painkiller, and you need to get admitted, you need to get investigated. We need to involve the senior in this type of case, because suspected cancer, or like suspected danger approach, you can adapt here. You should adapt here. Actually, this condition could be a kind of serious. You can have like serious head trauma. For that, we need to do certain investigations. For example, the CT scan of your head. And other your investigation we need to do is your X-ray to rule out any fracture, and we need to do like a CBC and all these tests. Okay, and after that, actually the gist of this scenario actually is being a safe doctor. You need to involve the senior in this, and you need to do all these investigation in the emergency, because you are in the emergency point. Okay, and offer the painkiller, obviously. Then comes the another approach. It is 7:20. Okay, we are going to discuss the dizziness approach, and then I think this will be the last approach we are going to do today. Dizziness approach, because it's the similar. After that, the confusion, I had made the notes for the confusion, but I don't think so we can discuss this today. Dizziness is can you tell me about the dizziness? You ask about the dizziness. The patient say, okay, the first question always about is what brought you here? Okay, I feel dizzy. It's very open-ended. Again, like tiredness is very open-ended. So to specify this, what you're going to do is, do you experience of building rotating around you, or light-headedness? Why? Why we ask these both questions? Because building is spinning around means any balance problem. Lightheadedness, patient can say dizzy with like anemia even. Patient can say dizzy like blackout. Patient is blacking out. For example, any problem of your heart, any heart racing, patient can say this to you. So you need to ask on the dizziness, you need to ask the world is revolving around you, or buildings are revolving, whatever you want, or you feel lightheadedness. Okay, this is the first question. Then you can ask these questions. Any vomiting? Does vomiting make it better? Does become better if you do not move your head? Because patient, we are going to talk about the dizziness is what a building is rotating. We are talking about that, not the lightheadedness. Lightheadedness we have talked about already. We are talking here about the buildings are revolving, actually the balance problem. So here are the questions we need to ask. It become better if you do not move your head. Does the vomiting make it better? Does closing of your eye make it better or worse? Closing of eyes never make it better, making it worse. Does laying down making it better? Okay, differential diagnosis. So here are the differential diagnosis, like it could be actually the panic attack and trauma, acute otitis media, labyrinthitis. These are general differential diagnoses, but we are going to talk about the differential diagnosis related to our scenario in there. You can just give a read to this. Okay, we have a very common scenario. Actually, it was in my exam as well, and I get past this exam as well. Actually, I should tell you, it's only a little story. Actually, in this station, when I was, this is the station, vestibular neuritis history scenario. Okay, actually, the scenario was the patient came and he. Yes, association with, we are going to talk about this scenario. I just gave you overview of dizziness, not about the DDs. We are going to talk here. Okay, I'm going to talk in detail about the DD. Okay, the vestibular neuritis actually was the patient has a dizziness, it was a child and was in a shopping mall. That was the scenario. And why I've been asking all the question, and the most important question in this is you ask about the viral illness. If you ask about the viral illness, the patient tell you, you reach towards the diagnosis to some extent. Actually, when I was about to disclose the diagnosis, and this word vestibular neuritis skipped from my mind, and because that was the exam pressure as well, and in my mind was coming optic neuritis and labyrinthitis, and vestibular neuritis was not there. And actually, I knew that it is vestibular neuritis. And when I prolong a bit, like we explain in the way I tell you that actually you came with this symptom, and after that you had the viral illness, and luckily, and this abruptly came in my mind, and then I start saying, and I got 9 in this station as well. Okay, we are going to discuss this scenario. Dizziness. Okay, patient present with dizziness, feeling building is spinning around. You ask the question, she's going to tell the building is spinning around, your world is revolving around. Went to the market shipping, suddenly felt dizzy. Same, the scenario was there. Same scenario was there. Your symptoms started 3 hours ago. You could not stand. You felt sick, but did not vomiting, because you are going to ask about that. Ambulance came 2 weeks ago. You had a flu, because it is the clue. Actually, this is the clue, because vestibular neuritis or labyrinthitis both are the same, both has the same etiology. Only there is a only difference. Okay, anybody can tell me the difference between labyrinthitis and vestibular neuritis? Anybody? Because both are the same. If they want to check you, they can change only a little bit of information, and it will be labyrinthitis. Etiology is the same, treatment is the same, nothing is changed, only the diagnosis is different. Difference between labyrinthitis and vestibular neuritis? Anybody? No, infection preceded in both. This is not the difference. Okay, I give you the clue. The difference is with the symptoms. Because labyrinthitis and both are the viral infection. Any clue? Because you need to ask these questions, because you will ask this question, otherwise you cannot differentiate between the labyrinthitis and vestibular neuritis. Actually, the problem is two questions: hearing loss, one, and tinnitus. Tinnitus and hearing loss is with the labyrinthitis, and vestibular neuritis is not. Okay, so this should be in your mind. No, balance problem is with both. Balance is with both. Predominate the hearing problem, exactly. Predominate with the hearing problem with labyrinthitis and tinnitus as well. Okay. So again, we start this scenario. You start by paraphrasing or what brought you here, whatever you want to. This does not carry a lot of marks. We should not stuck in that. Grapes, ask name and age, and starting again lightheadedness. Then do the tupa. You will be doing the tupa. That how did it start? How it was the first time, you are having that before as well. Asking all these questions, duration, how that they lasted, all that, because BPV only for the 3 seconds. BPV scenario is only, BPV is actually with the abrupt change in position, you gull the dizzy, that is the BPV. Okay, associated symptoms, DD. Now you need to, you have asked about tupa question, then you need to ask about, you have asked about the tupa question, then you have asked about associated symptom, any other thing you want to tell. Okay, the patient says nothing, or she may tell you something. Okay, then other question, ENT problem. What? Hearing problem, one. Always the balance problem, ENT should be at the top. In the balance problem, ENT should be at the top. Any problem with hearing, tinnitus, any balance problem. Okay, labyrinthitis, have you been unwell? Okay, this is the for the labyrinthitis and vestibular neuritis, the same question. This is not typical with the labyrinthitis. This is the same question. You have been unwell, because you need to ask any recent flu-like symptom, any recent. Here he is going to tell you that yes, I had some flu-like symptom 2 weeks ago or 1 week ago. So here you, any heart problem, chest pain. Now you are always also before you need to ask about the balance problem, then you are going to ask about the, I'm going to put that cut above, because the balance problem should be asked first, because he told you that the world is revolving, you cannot mix them. Then ask about the postural hypotension. What question? Are you taking any medication? If you are not asked here, don't worry, you can ask in the desert. You have to ask otherwise. Any heart problem, any lightheadedness or heart racing, because you have asked about the heart lightheadedness, only be asking here about the heart racing. Any diabetic medication are you taking, because lightheadedness can be due to hypoglycemia. Complete the PMA desert, and then blood pressure sitting and standing, GPE, ENT examination. Here it is quite important. Offer the tuning fork test. I know that they are not going to ask you to do that. Do the ENT examination and offer the this is important, ENT and phonic tone test, and then chest and chest examination as well, because tuning fork test is where they can give you the reading regarding the hearing loss. There is no hearing loss. They can, okay, there is no hearing loss, so it's not labyrinthitis. Okay, similar eye examination, neurological examination, you are going to do all these examination. And other important test is Romberg test. You are going to ask the patient, can you please stand for me and close your eyes for me, and he is going to know about that. You know about the Romberg test. This is about the balance test. So these tests are important here. In any imbalance dizziness scenario, ENT and phonic tone test, ENT test, actually ENT examination is important. Sitting and standing BP is important, and Rombung test is this test, gait test is important. You're going to, because if they close their eyes and you ask them to walk, they have the problem, because a lot of problems generate in this way. You close their eyes, ask them to walk, and they start staggering, and there is the problem with the balance. And balance problem can be due to any reason, not only because of the vestibular neuritis. That could be the hypothalamus, due to thalamus problem. This could be a many problem. This could be due to ear, because three senses are required to maintain the balance. Any of them get disturbed, because any get disturbed, eye, brain, and ears problem are required to do the coordination. So philosophy regarding the Rombung test is eyes you closed, and any of the other two is two are required to maintain the balance. Any of two is missed, so you will get this test positive. Okay. Okay, explain the diagnosis, summarize the finding. Similarly, that you came with this symptom and you had this infection and we did this test and that, and you are having, you had the flu problem, and say that, and you, the condition is called vestibular neuritis. It is the inflammation of your nerve which is responsible for your balance. Inflammation of the nerves, the swelling of your nerve which is responsible for your balance. Okay, so management, actually the management is rest. So I have written the management regarding that, because sometimes the patient says that, okay, I'm getting vomiting and I'm getting a lot of trouble with that. So in that case, you need to get the patient admitted, you need to get under observation, or you need to get to the emergency. But here in this scenario, it is not required. So what you need to do is, the only lifestyle modification. It is self-limiting condition. You need to tell to the patient it is not the dangerous condition, it's the self-limiting condition. It will go on its own, but it will take a bit longer, even though the infection will go away and you can have this problem for a longer time. For that, you need certain lifestyle modification. And what are they? They are here. Okay, yeah. Actually, I want you to, actually, I think I should have got the time to, I could not, this is on the notes. I could not like put from the NHS website. Actually, its management is, should be elaborated, because the lifestyle modification, I have mentioned you, but what lifestyle modification? Because the patient need rest, patient drink and plenty of fluids, because all these kind of management are required for this. And safety netting is again important. What could be the safety netting? Any student, what could be the safety netting here? Meningitis and severity, because it is related to like infection, and any signs of meningitis or any severity of the symptoms, you need to get come back. Okay, students, for today, we have taken the class for almost 2 hours. So any question or any question answer session, so that we can discuss about today class. Because I have the confusion scenarios with me, but today we cannot discuss that, because we have discussed in a very detailed way, because this section is quite important, which we have discussed, even the confusion. And in the next, on the Friday, I'm going to try, it's off, but because actually I have a ALS booked in Islamabad, so I'm going to try that. I teach you, if I get the time, I will try my best to get the time, to not waste your time. It will be the confusion, it will be headache and backache. These 3 sections are equally important, like this we have studied today. Any question, anything, any person want to ask, because I always encourage your asking question. Yeah, schedule for this has been given. I think it has been shared. Otherwise, the Friday class is, because the tomorrow and day after tomorrow is the counseling session, which no, it's not tomorrow. Tomorrow Dr. Hira is going to take, and after 2 classes will be with Dr. Adil, and then Friday I'm going to take the class. I will try my best to take this class, otherwise it is off, because I have that day ALS in Shifa Medical. And then on the Saturday, Dr. Junaid will take his session on the combined scenario. And let me tell you, students, this is a quite serious, we are putting a lot of effort. Trust me, it's taking a lot of work for us to do, and this is for you guys. And after that, after completing our course, we are not going to like give you leave you in the air. What we are going to do is, each week we are going to arrange 2 practice sessions, only practice session, no class in that weeks. That will be run by each of the respective. For example, we are going to give you the opportunity to practice with us, with yourself, by yourself, because sometimes we will ask 2 students to practice by yourself. So we will arrange a practice session that will be like a mocks for you guys, and that will be 1 month, 8 practice session we will be offering in the next month. So this is the second last week, and hopefully in the coming week we are going to end the course. Any question regarding today class? Okay, I invite one of you students to come and like do one scenario with me, because because this is the practice session, and I always encourage you guys to do that, because